Hey guys, welcome back to my YouTube channel. Today's vlog is about my second shift work routine being a clinical pharmacist and a research student. Without any further delay, let's get into a video. Before I go to work, I'll start my morning study preparation for a research paper where it involves in collecting the related topic articles and by them preparing the introduction, methodology and discussion. Results and abstract should be prepared by ourselves. So for preparing a one paper, you need at least minimum 15 to 16 articles, which I'm going through it. So on kind of a busy hectic schedule, and also it is very knowledgeable when you are going to explore about anything you want to know. It is very beneficial for you. As soon as I complete my 1 hour study session, now directly we'll go into my work section. In my workplace, as in a timetable, today I need to verify the data which I've been collected since from a 1 week by separating the data based on the results. And I really enjoy analyzing, interpreting the data of 20 to 30 patients per day, and it is one of the easiest tasks and very knowledgeable. And next, moving on, insulin injection process and explanation for the one of the diabetic patients where I got call for it. So today I'll show you how to explain the insulin and when to explain and what are the benefits and drawbacks and medication errors. One of my most critical aspect of my job is to ensure that patients' medication safety and usage of insulin properly after I'm explaining, because it plays a major role in controlling the glucose levels, very less number of side effects. And one more important role is you should make sure that patient is psychologically ready for an insulin, because if he or she is not ready for it, then you can't even forcefully take them insulin. And that is one of the patient's dilemma, that they are comparing the normal injection with an insulin injection, which is totally wrong. Normal syringe will be 5 ml and the insulin syringe will be 0.05 mm, which is 90% lesser than the normal syringe. So there will be a painless and bloodless. It is a new technique found by a scientist for a daily usage of diabetic patients, and I can say that's one of the greatest invention. So first I'll make sure that I will explain the procedure and I'll show them the needle and I'll show the difference also, then they will get an account. Furthermore, once the patient is comfortable with an insulin, I'll start explaining the process. First, I'll take out the pen of the pen cartridge separately. I'll fix them according to the procedure. Then I'll start explaining them how to fit it. Every 2 days, you need to change the needle and the one cartridge will be available for 10 days. If the patients are taking more dose or more than a 40 dose per day, then the cartridge will be completed within a 5 to 6 days, and the needle should be changed every 1 day, and the site rotations will be very different for the patient to patient. If it is in a normal diabetic patient, it will be around the umbilicus. If it is in a pregnant lady, it is around the thighs till the completion of her 3rd semester. For this patient, we are explaining around the abdomen. So end of an educational video for the students who are studying in diabetics or having a diabetic topic. It will be furtherly very useful for them. Moving on to the storage details, insulin pen vial cartridge always should be stored in a refrigerator on the door side, and always make sure to remove 15 minutes before of your insulin shot and kept in a room temperature, because when you take directly from the freezer, there will be a more painful when compared to keeping in room temperature. And if you are traveling in emergency situation, always make sure to buy an ice pads which are available in medical shops based on your traveling journey, and never and ever keep the insulin in a room temperature, because it might reduce its 50% of an efficiency. So this is one of the technique. Similarly, one more method, those who don't have a refrigerator, they can keep their pen in a small earthing pot within a closed container, and the earthing pot should be covered within a wet cloth, so it will provide a temperature inside. It is very beneficial for it. So here is the simple techniques process for storage. Moreover, insulin techniques will be different based on the types of diabetes. For example, for a gestational diabetes, first 3 months we will explain around the stomach or abdomen, and from the 3rd month to 9 months we will always make sure them to take in the thighs and every occasional day, and always make sure to change the needle for a 1 to 2 days if the severe pain is there. So here is the end of the video. Thank you for watching my video, guys. Please like, share, subscribe my channel, and take care. Good night. Have a good day.